So I graduated my medical school in 2009, and my kind of encounter with research started at the 5th year. I did MD, so I got like 6-year degree, medical degree, and I joined at the time a research journal club. Actually, it was at the cardiology unit, and I remember we had a journal club every week. And then I kind of decided to participate and take part in simple audit at the time on influence, depression, on ischemic heart disease. So that was 5th year of medical school. 6th year, my MD, I submitted the thesis, and I graduated in 2009. I graduated from university in Poland. And then I decided to change the scenery just for the experience, and travel and do an internship in UK. So I came over, I did my first year of internship, but at the time it wasn't foundation program, but I applied for the foundation, the regular pathway. I got accepted, and that was first year in Cambridge. Then second year was Liverpool, and I applied at the time for training, which I've been for national selection. And in 2012, I moved for 2 years to Belfast when I started my first cardiothoracic job. After that, I did extra year of ST3 in order to prepare for national selection in cardiothoracic. And I applied for the number at the time, NTN. I've been appointed national trainee in cardiothoracic. And after 2 years, I kind of, in fairness, the research was always somewhere in the background, but as you go and enter the clinical training, the time moves fast. There's long working hours. So when I started my training job in cardiothoracic, I kind of always wanted to do something of my own, let's say like this, rather just deliver the service. And I was searching for 2 years for kind of opportunity or good project. So I was always looking out for it, but maybe not always actively go to bosses. I did mention to a few professors at the time. And then opportunity kind of arrived when my boss got in touch with a Leipzig Heart Center, which is one of the biggest cardiothoracic centers in Europe, very prestigious, that they're looking for potential research PhD trainees to do animal studies. As we know in UK, in terms of large animals like pigs, sheep, dogs, it's very difficult to get that kind of fellowship. So I got very excited. I remember I applied for the job, although I wasn't quite sure will I be good enough. But I already had 4 years of surgery behind general and cardiothoracic on my CV. So I kind of I was a good candidate. I was selected for the job. I got appointment. It was international research fellowship, and I kind of combined that with international PhD and register my PhD at Queen Medical University, QMUL in London. And I kind of 3 years did my PhD. At the moment, I'm going to submit my thesis. And the last year, during my PhD, the research I did on spinal cord ischemia in aortic surgery had a very, very good results. So I kind of wanted to continue that. And that's where the academic clinical fellowship is very handy and very useful when you can combine clinical and research pathway and help yourself kind of generate time for both, because clinical job is extremely busy job, as you all will experience, I'm sure, regardless what kind of specialty students encounter. And that's how I applied for national selection and got appointed as an academic clinical fellow. So the road is long and it's full of obstacles and kind of things that you need to face, but it does pay out. But you need to kind of be open-minded, I think. Hello?
Right. Thank you so much for that, Urszula. So I think you've covered the first point that we were looking to address in this session, which was an overview of your pathway into research. Could you give us a few things that motivated you into doing this? I know you mentioned that you were looking for something. You weren't just looking to tick a box, but you wanted something that interested you. So what would you say would be a good mindset with which to approach a research project?
I think, in terms of motivation, maybe I will answer the first part of the question. In terms of motivation, guys, whether to do research or not, whether to do research when you're clinical, when you trainee or non-trainee. There are various motivations, but you need to remember whichever path or whichever specialty you're going to choose. These days, the research, whether it's a simple clinical and audit improvement project, whether it's advanced, it's simple even retrospective analysis of particular topic, or whether it's a proper research which involves, prospective study, a randomized control trial. It's all kind of required on your CV. The research, this current era of job applications is required. So for example, if you're going to apply for FY1, everyone will ask you about whether you took upon any extra projects while you had your, clinical assignments in particular, areas during your, whole 5 years, 4 years medical degree. Based on that, you will get extra points, or you won't, get extra points. You might be allocated to particular hospital, or you might not. So it starts at the very, first FY1 foundation year application. If you're going to say, oh, I would like to be a surgical trainee or medical trainee or even GP, when you're going to apply for at your level of F2, sometimes it's still core trainee still available, but most of the jobs you have to apply at the beginning of F2. You will be required to provide your audit clinical improvement project, which is a simple research. As a first author, you will be required to provide first and second cycle to close the loop and introduce some kind of practice into, some kind of new practice on improvement into clinical practice. And you will be required later on, depending what kind of job you're applying to. If that's, for example, cardiothoracic, neurosurgery, or even general surgery, they do require from you three first authorship of the papers. And when I say papers, it can be case reports review, it can be retrospective analysis of some sort, prospective analysis, or part of the study, but publications. So you need to keep in mind that research, whether it's clinical improvement project, whether it's retrospective study, or simple, let's say, meta-analysis, right? Which you can do even at your stage, it will be required from you. So the motivation is one, job, okay? So for the job application process, you will be asked to provide some kind of sort of research, from simple to more advanced. Then obviously it's your topic of interest. If you're going to do any research and if you're going to try to then go to the interview, and because they will ask you obviously at the interview, what kind of research have you done? It's nice to talk about something that you like or you're interested. So another motivation is passion. If you pick up a subject, even before you go to your supervisor or consultant, think about something that you would like to find an answer. It's like, you know, question and answer. So what interests you? You can always suggest that. So it's very good if you not only do something for your CV, but, you know, that you're interested, passionate about. So for me, it's always been both. I obviously knew what you always look at your matrix and requirements for the job. So you always have to do, but, you know, I could never force myself just to do, oh, why don't you go and check this wound infection process? And, you know, like, but why? I'm not that interested, right? So I was looking for interesting topics that I can do the analysis. So I remember when I was in last year medical school, and I went to this cardiology journal club, because cardiology is actually, they're very active, and you can see so many publications. And yes, and you know, my consultant asked me, so what do you want to do? I was like, actually at the time, my grandma got a heart attack and she was quite depressed. It was like, are there any connections between, you know, like old age, depression, and ischemic heart disease? And it's like, well, there are some evidence, but don't you look at that? And that's how it started, like seriously. So my first small randomized control trial was at the 5th year medical school about influence on depression on ischemic heart disease, so the pressure and sex, right? So very, like, you know, seriously, that was my topic. So every time then someone opened my CV and read the research, they're like, so what is this depression and sex connection? Like, because sex was actually female-male. So because ischemic disease obviously is differently distributed. But so what I'm trying to tell you guys, you will be asked to do research, whether it's clinical improvement projects, audits, or basic case reports, you know, unusual case reports. You can always report to BMJ simple journals, or, you know, some advanced studies, depending what kind of specialty you're applying for. Then, if you really want to get into the research, or you want to continue both clinical and research, you can always combine that with academic pathway. Or if you're really into research, at your stage, you can think about applying for PhD. So whether you trainee or non-trainee, right? You apply for the number, or you came from somewhere, or, you know, you simply haven't made up your mind what kind of specialty you want to do, and you want to try different things. You can always find potential PhD projects. You can ask the consultants in your placements in the hospitals. You can try to identify academic people before you go to the placement. Please send an email to consultants, say, well, I want to do research, or I'm interested in research. Or if you're not, just say, well, I'm interested in audit and clinical improvement projects. There's always plenty. But think about this now, because when you start your FY1 job, and when you go to hospital, you will be overwhelmed with work. There's, you know, you will be overwhelmed with new environment, and you won't have that much time. So sooner you start thinking about that and setting up the project, even during your 4 weeks treatment. We have medical student now with us. And, you know, basically he said, oh, well, I want to apply for cardiac surgery. So I presented him, I showed him how the matrix looks like, that, you know, the requirements are very high and they're increasing now. So when I was applying, I think at the time was audit and research, like one first author, second in 2 papers, 2 authors. But, you know, I didn't have to be first author in all the publications. I still get maximum points. Now this is different. So every year, recently, within the last probably 5 years, kind of impact on research is increasing. And as I said, there are different levels of research. And even if you don't have a project, you can always do meta-analysis. What's that? It's a review on a topic. So you review the evidence on a PubMed and you apply for that. So motivations are different. Motivations, whether it's work, whether it's passion, I recommend both. Try to do something, because then it's easier to talk about an interview, and take from there. In terms of academic pathway, particular academic pathway, I have a slide which is a picture which I can share with you, and we can talk about if someone is particularly interested in applying for ACF, Academic Clinical Fellowship, and NIHR grant. NIHR is a National Institute for Health and Core Research. They have a very nice programs which you can apply for, integrated clinical and practitioner academic programs. And you can apply that with your PhD, or, you know, it's actually more designed into preparing you for particular, let's say, PhD work and integrating and, you know, demanding research hours into your clinical practice. So I can show you the theme and how does it look like later on. But yeah, so I would say you kind of try to combine two motivations. You know, work and you won't get, basically, you cannot move forward if you want to even basic projects. It will be required from you at the interviews at any stage, and especially later on, even as a consultant.
Thank you so much. That was very insightful, especially the part where you said that when we pick a research project, it should be fueled a lot by passion as well, instead of just ticking a box. So that was very helpful for me too.
Trust me, if you didn't just to tick a box, later on you go to interview and say, so why did you pick up the subject? What you were interested? Oh, tell me something about, and repeating the answer. And trust me, it's at every level. At your F1, then you apply for core training or run through project. And then even when you're at the specialty, you say you go for academic job or consultant job, you still need to talk about that. So, so think about what is interested and who can actually supervise you well. Supervisors are everywhere, but not everyone are good. If you sometimes have a feeling that supervising is demanding a lot from you, don't be discouraged. It means they care, they read your paper, they read your email, and they just trying to get the best out of you, okay?
Correct. On that note, could you also give us some insight on how do you pick the right supervisor if you're interested in a project? I know you mentioned that you have to read around and see what topics or subjects that the professors are doing, and then based on that, pick a supervisor, but they're extremely busy as well, right? Yeah. So from a medical student.
There are various supervisors you come across. There are mentors, right, who can mentor you and help you with different pathways. There are academic researchers, and then if you visit the academic centers, laboratories, universities that you belong to, right? So at universities, your lecturers. The best easy way sometimes to Google people, just Google and see, have they actually done what they're talking about and what they're actually working. Sometimes you can ask for one block of research and let's say transfer. So even if you're as a FY1, remember when you apply for jobs as a foundation trust doctors, as a foundation trainees, you can apply for visiting time. So we can apply for 1 to 5 days. I think even in the block of 2 weeks, if you apply in advance to your academic supervisor, or even clinical supervisor, depending on what kind of job you have, you can ask for this. So say, oh, I would like to actually visit this hospital. Obviously in advance, send an email and say, oh, I would like to come and see a hospital, find out more about your unit. I'm considering, coming over, or this job or specialty. Would you be, able to help me out? And they will probably accommodate you as a visitor, and you can always go and check and then query about the research centers and jobs that they're doing, the research that they're providing.
Okay, thank you. And now could you give us a brief overview of the academic trainee pathway, and if it would be very different from a non-academic trainee pathway?
Let me just share the screen with you. Let me just so is it in video settings? Share the screen, share screen here. Can I do this from my side or?
Yes, you can just click share screen and it should show up ideally. Neeraj, can you help us out with this, please?
Can you see that?
What do you need? No, I can't. Did you do? I made you co-host. Did you do this? Share. If you press share screen, and then just click on whatever item you want to open, it should come up.
When I go to video settings.
Don't go on video settings. Go to share screen.
It's in the center. It's a glowing green.
Oh yeah. Sorry. Let me see. Can you see now?
Yes, we can.
Yeah. Let me just increase that. So this is from the pathways at the MBBS level, so your level, right? So when you at the uni, you can basically finish, you graduated, and you apply for foundation year. You can apply at your stage for academic foundation program, and that will set you up for academic pathway. That kind of jobs you can, as I said, research at the NIHR website, which has fellowships and jobs advertisement. You can as well query at university and the unit that you go potentially for, your future jobs. During, let's say you apply for clinical foundation year and suddenly you're like, well, I wasn't quite sure at the uni whether I want to, do research or not. You can still apply. You can apply for academic ACF, academic clinical fellowship, and that will be a preparation for your future PhD. If you, at your level, you finish to graduate and say, you know what, I'm not quite sure what I want to do, but I would love to have PhD. You can apply for a PhD at your stage, and please, if someone will tell you that, oh, you cannot apply for ACF, you still can. It's written in the rules whether you have PhD, with your PhD or without. For example, you can apply for academic ACF or academic foundation program. So, finishing your PhD does not exclude you from getting still an ACF number, because they will say, well, integrated pathway is actually to set you up for PhD, and it is. But for example, in our specialty, like cardiothoracic, maybe neurosurgery, the jobs is very, very demanding and competitive. And honestly, I could not imagine myself with enough experience to do a PhD, during my working hour, because what does this involve? So you applying for academic fellowship, as I mentioned earlier on, it combines clinical and research pathways. So what they say and what you can apply when you get your job, when you apply for the job, you can say, well, I'm interested, and usually it's in 20% of research time and 80% of clinical job. So in your program, in your clinical program, you will have, they will incorporate 20%. What does this mean? Does it mean, do I have to go once a week and do my research if I don't even have a clue what I want to do research about? Or, do I have to go 1 week but no, this is flexible. So you can take this 20% of your time in the blocks. So over, let's say your academic foundation program. So that will be over 2 years. If you apply for ACF, academic clinical fellowship, so while you are F1 and F2, you apply for ACF, that will be over your 3 years. Or later on, if you finish your ACF, then you go off, do your, let's say, 3 years PhD, you come back, and then with your PhD and your experience, you apply for clinical lectureship. So, and then obviously the clinical lectureship is kind of 50-50%. So academic foundation program, as far as I know, I think it's 5 to 10%, then 20%, and then 50-50. So higher you go with your research career, more time particular program is, is kind of asking you to, sacrifice or, spend time on doing the research. So at my stage, I'm ACF, so I will do 20% and 80%. Although you can always, it's flexible. You can go down, let's say 10%, 90%, but they won't allow you to go up like 30 and 70 because there's some clinical expectations. So while you progressing with your clinical job, you have to as well progress with your academic job. And it's difficult and it is demanding. So you need to remember that it's not an easy pathway, and none of these pathways is straightforward because you will have to deal with your clinical duties, which is 90 to 80%, and then to 10 to 20%. Obviously, when you're clinical lecturer, then you have 50% time, 50% of your time in the clinic will be dedicated to your research. And it's obviously it's dependable what kind of research and which level you are, right? But for me, doing PhD first, I learned so I learned my basics, yes. So I learned how to research the topic, how to do meta-analysis on particular topic or systematic review. Then I went to the lab and I learned to, show up, be there, do my samples. I operated on animals first. So I had to do animal course, with vets, which was exciting, by the way, and operating on pigs. It was actually, they're very, very nice animals. So, but as well, I have to learn all the anatomy, the rules, welfare, and follow all this, the whole pathway. Then when I operated on pigs, I took some samples and I would go to laboratory. I would analyze my samples one by one, pipette them. Then I would do histopathology analysis. So all that required from you, your time and effort. Integrated pathway, NIHR programs are there to help you to find the interested topic, have a secure time during your clinical hours for research, and potentially, I say potentially because you don't have to do a PhD afterwards, right? So you can, for example, apply for ACF, you can explore, write the papers, explore different things, and in the end you'll say, well, actually, I'm not that interested. I think I prefer to stick to clinical job. Or you can say, well, actually, no, I'm done with my clinical. I will finish ST8 and I would like to go and do, senior lecturer at university, or I would like to become consultant. And while doing my practice, my knowledge, in terms of, setting up randomized control trial or improvement project, that proper one, not that kind of, brief one, in my future consultant job. So one way or the other, NIHR can provide you with the money for your job, because this grant, this is not a grant, this fellowship will pay for your clinical job and will provide you with the opportunities and support in terms of applying for grants, NIHR grants, and applications for potential research, like Vice Charity research, welcome grants research, and grants and everything. I didn't talk about applying for the grants because at your stage, quite often you will need a consultant or professor who will have particular grant, and they will basically create the PhD opportunity for you that you have to apply for. But as I said, applications, any application for the job, especially for research job, they will ask you for, have you published? If you publish, what do you publish? And I was like, well, I haven't done the job. I'm just a medical student. Still, while your assignment, clinical assignment, you can do small projects. Even if you don't, your clinical assignments, or, it's not, the topics are not interesting, they're not something that you're excited about. You can do meta-analysis, you can do systematic reviews. So, what you need to do is to just keep your options open and ask for it.
Thank you so much for that, Urszula. On that note, can I ask a question on behalf of the students? So you mentioned that if it's hard for them to find some research, they could do a systematic review or a meta-analysis, correct? So let's say they're just starting out and this is their first paper, then how would you advise them to get information on how to go about it?
So if you're doing meta-analysis, for example, you can Google Cochrane review. Right? Cochrane review is the most actually difficult and demanding, but you will get the gist and understanding that when they ask for systematic review, like anything in research, it has rules and some kind of pro forma that you follow. If you write a paper, first they will ask you for, summary and abstract. They will ask you for general overview. Then you will have to write the methods. Then you will have to present your results and then provide discussion, let's say meta-analysis or systematic review. So meta-analysis, for example, that will be Cochrane review that you will read and follow. You can do Prisma, systematic review, that's European guidelines. And then you will literally find diagrams of, you can, with Cochrane, you register your particular meta-analysis and review, and you must have 2 reviewers. If it's systematic review, following Prisma protocol, that's European guidelines, then you, for example, follow that kind of a Prisma guideline, and you create a special diagram. So whichever stage you are, you can easily gain information from online resources. Google Scholar will give you papers, although I still, recommend PubMed, Medline. They're all valid, very good website that you can Google. Just type how to write meta-analysis in PubMed. Every university has patent account and access to unlimited online resources. And those online, if you go to your library and you ask in a library that you would like to have an access to resources, they will provide you with a password and they will register you. They actually, remember, use your resources at university or even in a hospital libraries. For example, Barts has a library. You go to particular library or university and you say, well, I would like to do a research or meta-analysis on, let's say cardiopulmonary bypass and procedures. You can actually officially put a request, and a person in a library will provide you with the research. They will actually do physical research for you. I did that when I was FY1 or 2. Although you need to probably specify more your topic. Don't give them general topics, because I end up with the pile of, I think, 200 pages and I have to review 200. But this is part of your, this is part of your research. And this is part how you, ask for the knowledge. So yes, so meta-analysis or systematic review, retrospective review, prospective review. Then you have your randomized control trial, and this meta-analysis is the higher level of evidence. When it comes as well to writing and research, please familiarize yourself with the pyramid of research. So what is one level, 1A, 1B, level 2, level 1, 2A, 2B, level 3 and 4 kind of evidence level, medicine evidence level. Sorry, I just had it. So yes, so that's what you want to know before you start writing up any paper or designing any. But meta-analysis can be done by you guys. And this is 1A, the highest level of evidence. And trust me, not, everyone will, bow in front of you because it's very required, but very demanding kind of a publication or research. And you don't need much. You need you need a supervisor. You need a supervisor, but you can as well download for free Cochrane review, meta-analysis, and analyze the results yourself. And publish. It's really not that difficult.
Thank you so much for that. Can you give us an overview of a typical week in an academic clinic fellow?
Wow.
I know it's not fixed and it's flexible, but a general view, just so the students know what they're probably getting into should they choose the path.
Academic fellowship. So as I said, it's my it's over 3 years. I'm expected to use around 20% of my time. And as I said, it depends what would you like to do. If you have already set up research, you can have 1 day a week, or you can take this in blocks of weeks, 1 to 3 weeks, or I can take up to 3 months in a row. So my week usually, as a cardiac surgeon, we have 2 to 3 operating lists a week. I have 1 clinic, and I try to use 1 day of my academic research time, of my research time per week. So I can catch up with tracing results, consumables, dealing with administration, because you would be surprised how much time when you enter the program, or when you set up any big trial, like we set up randomized control trial as a part of international trial, how much work and paperwork it actually demands, how much time is spent on the paperwork. So if you don't like paperwork, definitely research is not for you, okay, guys? So, it's actually, it may be at the, first level, like audit or clinical improvement project or simple retrospective analysis. But if you don't like paperwork, you probably should not go into that, big research studies, because it's a lot of paperwork. Or sometimes if you can get a big grant, you can get a research nurse and they can do this for you. But still, there is a lot of paperwork that you have to complete.
We might need a future session on time management. I mean, if that's the case, I'm not sure, because it sounds very challenging.
You know what research really teaches you? Self-discipline. Because, for example, PhD, if you won't force yourself, probably a supervisor won't be chasing you that much. You have the deadlines, and there are various ways to deal with that. Some people, they're very organized, and they like to distribute. The same as, we all study for exams. Some people, they do this in small sessions, small parts. So I, for example, that's what I do with my research now. I try to do 1 day per week. If I can, then sometimes obviously 2 days per 2 weeks, or 1 day per, obviously it depends. But, if I'm on call, like let's say this week, I was like, 3 nights, I haven't done much. Although we have a meeting with Prob, and, I'm behind with, a few emails, a few phone calls, and, and I have actually presentation this weekend at the meeting. So there's a lot of things to kind of tackle. But yeah, you need to, I think, whether you like it or not, you will be forced to be organized, let's say like that. If you don't, then yeah, you run into troubles. But then there is a element of improvisation. So when your research goes wrong, let's say you decided to go G and the results are not work, or like, you know, I remember when I was actually setting up my animal project, right? First of all, I didn't have money for my samples because my money involved the pigs and my work, but I couldn't get an extra money for consumables. So I was like, oh my God, what I'm going to do, right? Well, my research is going, no, research is one of those things that you need to find a way. You need to knock on 10 different doors. You need to, if someone doesn't let you, you know, by a door, jump into, you know, window. Only this way you really quite often can succeed, because, you know, money quite often is short, or your boss doesn't have, and you have few ideas in your head. So, you know, for example, me, I email people in States, I email people in Sweden, in Germany, various. I supported email from Sweden and from States, and having all that, I went to the company, and I spoke, to the company, and I said, listen, will you provide me with, three consumables and this cannulas, and I just want to try something on my pigs, and this is this project. So we wrote the project, I wrote the plan, business plan, how much money or how much samples I need. I made an effort to actually go and see the professors in, let's say, Berlin or Sweden during, I was like, oh, I will have holidays. And I made appointment, I spoke to them. And, when they see, the truth is, guys, if someone see that you're eager and passionate or, really want to do this, it will be very difficult to find people who won't help you. Like, if you go to someone and you have ideas and you did your research or readings, and they really, people are excited about it. Because not many people want to invent something. And remember, your research doesn't need to be very repetitive. It can be innovative. It can invent things. You can improve things, really improve. So there are various, let's say, didn't talk about grants. There are various grants. The grants like William Harvey, for example, Institute and QNUL, they can provide you with a grant for your salary. You as F1 and 2, you can take upon RMO job, and and then they will, for example, provide you with time, 2-3 days a week when you can do your research. Then there are small charity grants, Welcome, Bart's Charity, British Foundation. There are small consumable grants for young investigators like we are. And you can write up with your professor a small grant. It's 20 to 15,000. Sometimes, if you can't even get that, set up an, marathon and run a marathon and raise £4,000. And that's enough for the first 3 patients or the first, the first data and then you can apply for bigger grant. So it always starts from small and then you work your way up. You apply for, let's say, foundation, 2 years, and then I did foundation research and, or I did some foundation project, and then I can apply for ACF. And, it always starts from small and kind of builds up, higher and higher. So, don't get discouraged, because there will be lots of people who can tell you, oh, you can't do this. Please don't do this. I heard, I don't know. I think when I apply for cardiac, because a lot of people are actually like, there's not many females in cardiac surgery, but I heard all the time I wanted the job. Like that was normal. Like, trust me. I was like, yeah, but fine. It's not the end of the world, but I will do the best I can to get the job. And then you get the job, and suddenly, oh, we always knew. But don't get discouraged. Okay, they will tell you lots of different things. Or when I went to Germany, they were like, oh, how did you come up with, with this, microdialysis method? Like, someone told you, no, actually I researched, I kind of, I knock on a lot of doors, because that's how you, don't be shy, okay? Don't be shy, be proactive. Life is short, and no one, even, I haven't met many people who say, well, you know, why did you ask me? You know, it's better to ask than stay silent, especially to your stage, okay? I'm talking about eager medical students who are trying to explore what they would like to do, or, you know, the job they would like to do. So yeah, so ask and look for support, because it's there.
Thank you very much. That was very inspiring and encouraging, to say the least. So I understand if the medical students want, they can reach out to people in other countries as well if they see something of interest. They don't have to restrict themselves to the UK.
No, because, well, actually my grant was Horizon grant. When we were in the European Union, there was a huge amount of money provided by European Union Horizon grants, and they were given to a lot of countries. So I applied for it, you know, my prof was Heisenberg professor, and it was Horizon 2020 grant. That was who actually paid for my research. So what actually, yeah, I did a little bit early, but what I should have done when I got my research, because it was research fellowship as well, guys. It wasn't at the beginning, it wasn't like straightforward PhD. I was like, you know, I'm going to take a break after 2 years of my clinical work, because at the time I did my F1, F2 core training, third year extra, so 5, 6, 7. So I had 7 years ongoing clinical job. And I want to have a break, you know, I wanted to kind of have something of my own, something that I can, you know, be passionate about. It's something in your background and no one can take it from you. So yeah, so I remember that's how I kind of applied for research, and it was 6 months, but it was good. So I was like, oh, can I have a PhD out of it? And they extended the time out of training. So when you apply for foundation year, when is it, you know, core training or national training in any GP, surgery, medicine, psychiatry, you can take time out of training and provide for example, for, you know, at the time was research fellowship. And then I, you know, converted that to PhD. And while I was there doing the research, I was like, well, it might not be recognized. So I was worried that it won't be recognized. And I wanted to transfer here anyhow to UK. So I applied for, you know, I registered my PhD and, you know, and kind of, you know, ask your colleagues. So usually networking is very as well good and useful. Go to meetings, go to conference, get to know people, take their emails. As I said, you know, be proactive about that, and, you know, be open about that. You know, don't worry that I don't think many people would judge you, and if they do, don't worry. You know what I mean? But, you know, you have to start somewhere. Yes. And somewhere meaning, you know, from, you know, even you know, will to do stuff like, you know, like this, like research or projects. It's always welcome.
Would you like to give them a few tips on how they should network when they go for meetings as students? With regards to approaching someone, pre-preparation.
In every, like now, for example, we have a Cardiothoracic Society meeting. I remember I went to trauma meetings in Bournemouth. I went, when I was at 1 or 2, I went to international meetings, and they always have a cheap fee for the students. You can always, as well, when you go for your medical assignment, always ask consultants. They do have grants for, you know, to pay for some, you know, whether trainees, students, especially, for example, you do clinical improvement, like simple audit, or you do some kind of review or a small retrospective study, you help them say, oh, I would like to go to this meeting, but, you know, my finances are not great. I'm still a student, or I just become FY1. Do you have some kind of money to support my journey, right? And you can start small, you know, it doesn't need to, you don't have to fly to States, you know, it can be small, but they do have funds in the hospitals, trust funds. They have funds at the university, the professors, so you can always politely consider the option or ask that you, and or just simple say you're very interested, but you know, you don't know exactly how to do, and they will direct you.
Oh. And once they're at these meetings, let's say they have a research project in mind, how would you advise them to approach a particular consultant or a professor with regards to networking?
Well, it can be, sometimes it can be tricky. The easiest when you present things and people come to ask you questions, say, oh, excuse me, and what's your name? Are you interested? How have you been? That's one thing. And then you get into, they will introduce you themselves, they ask when they work. So when they ask you a question about your poster, about, usually presentation, ask them, right? Ask them back and try to find out where do they work or what do they do? Sometimes when you go to meeting, you're particularly interested in the topic, you go to the talk. Don't be, I remember not once, many times I would approach a speaker, somewhere in a hall saying, oh, I just heard your talk. It's exciting, and what do you think about this? Or will you have time to, for example, talk to me? At work, I quite often ask my colleagues and I would send an email to, for example, I remember professors, I remember I think I sent to Professor Punjabi or Jahangir, people, and I was at the time actually called trainee, I wasn't cardiothoracic trainee, or I made appointment with even, I remember Mr. Shiponini, who I actually now work with, but at the time I never expected. So I would email people, I will ask who is, for example, academic or university professor, teacher, or who can advise me on, and I would email. And out of, let's say, 3 emails, I would have only 1 positive reply. The rest will be, why don't you ask someone else? Or they don't reply at all. Or at the meeting, they might say, I'm sorry, I'm really busy. But don't take this personally. Don't get discouraged. That's my point. Never, ever be shy to ask questions. And that's the essence of any research. You have to ask questions. You need to find out why this is happening, right? Why this sample didn't work out, or what I can do to improve the, practice in a clinical, board or even around yourself. You need to be curious. It's like a drug. You need to be curious, and then you kind of can move forward. And definitely don't take personally any, rejection or no answer. Just be open and ask questions. Yeah.
Thank you for that. Because sometimes, as medical students or even juniors, it can be intimidating to approach a senior colleague or consultants. So that was very insightful. And also the part where you mentioned trials.
You don't have to do this in person. Okay. As I said, you can type an email and, and just say to them, let's say you due to, do some kind of, 4 weeks placement. Right, you ask, you can ask obviously at the department which consultant you can be assigned, or you have particular interest in research or doing clinical improvement, and can I be assigned to clinical director or to, for example, academic or youth prof in particular department, and you introduce yourself and send an email saying, I will be coming to Barts, or I will be coming to Manchester University, or, or St. George's, whichever hospital you are in, let's say in 6 months or 4 months. I would really appreciate the opportunity to do a project or a small research, or, improve my experience in particular area. Would you be kind enough to recommend me any particular person or topic, or any registrar who is looking for students? If you ask, trust me, I'm sure they will, they reply, and we will be more than welcome to accommodate that.
Right, thank you for that. So on that note, it clearly looks like an academic clinical fellow pathway is much more difficult and challenging than a non-ACF pathway. Is that correct? Seems like.
I think so. I think so. Well, it doesn't have to be. As I said, even if you, let's say, apply for ACF, and there is a, you first usually ask, for job opportunities. So you ask professors, you have interest, you ask your bosses, because let's say you are already, around, medical environment, you start writing some papers, because you will, when you apply for those jobs, you will be asked to say whether you publish or not. That's why your clinical placement as a medical student is important to ask for the opportunities. And even if you're 4 weeks, you can still get in touch and come back and get the data. So so then you apply for the job, you get the job. But as I said, you don't have to necessarily finish this as a PhD. You don't have to continue. So, don't feel, I don't want to discourage you. That's what I want to say, because I obviously, it happened that I applied, to Germany, and I always wanted to do large animal projects. I couldn't, at the beginning, I didn't want to be stuck in a lab, although I've been, it was just theater, but I wanted to operate because I'm a surgeon. So I was looking for a job or an opportunity to do, although I remember there was alternative imaging project in London, but I was like, no, I will go for operating on pigs. And that's what I did. So I was still stuck, like, I think first surgery, I lost like 16 hours and I was terrified and I read everything I could. And trust me, I killed the first 2 pigs. I couldn't use the spinal cord and they didn't survive. And I was depressed at the time. But every time I learned something new, okay? So, and every time as well, even ICF, you get the job or you get foundation, academic foundation program job, and you might not want to do this in the end. So don't worry, it's how I discovered I went to the cardiac surgery by exclusion. I did many things, which I said, no, I don't like breast surgery. I didn't like medicine. I didn't like GP. And then I kind of by exclusion. So not knowing what to do is a good thing too, because you're open-minded. Knowing what to do might be even better. So it is challenging, but you don't have to, I don't have to be a professor in the end. Well, that's what they say. They're giving you opportunity to have time for your research, because during the clinical hours might be challenging. And if you're not, let's say, organized, it can be tricky to find these extra hours. Usually you wait for this block of, assignment when you're FY1. I remember when I did vascular surgery, it was challenging. I didn't have time, but then when I did GP, I had plenty of time. So I did more research at the time. Now I can say, well, this week I'm going to write my papers, or I'm going to do my lab, and and I ask in advance for study leave, and I'm granted. So there is, a lot of things I can do, while I'm, on my ACF. So it is challenging, but it makes things easier. It makes things easier for, to combine clinical job with your research. Yeah.
Right. That brings me to my second last question, I would say. What would the opportunities be following an academic trainee pathway, apart from being a professor, compared to that of a non-academic fellowship? And also, what are the benefits of it as opposed to doing only clinical?
Well, so I'm always, strong believer in you can do whatever you want if you're really motivated. But in terms of academic, it does give you, as I said, if you are on the scheme, you do have a lot of support when you apply for big grants. When you apply for the grants, national NIHR grants, okay, they're innovation grants. So various grants, and you do get support in order to apply for those grants, okay? You get a lot of network with professors, and a lot of doors opens to you, okay? So if you want to go and do some kind of, let's say, experience in the lab of, William Harvey or Imperial College, right? Or King's College. And there are particular areas that you're very interested, or, biotechnology. When you apply from a position of ACF or academic FY1, you are welcome, and they will create this opportunity for you, okay? They will, you can ask your academic supervisor or your regional or national HEE supervisors, and they will put you in touch, in contact, and try to accommodate that kind of research opportunity. So that's one, okay? So networking is easier, and you do get support. You have funds that you can do your, for example, statistical course. You can have funds, you can, for your research. Okay, small 1,000-3,000, but you get funds. You're presented with opportunities to apply for grants. If you apply for the grants, then you obviously, can have your own money or your professor's money for particular research and take on that. Okay, and so that opens, the pathway to further, to continue the research. In terms of, let's say I finish my ACF and I don't want to do, and I don't want to continue be a lecturer, right? I can be consultant, but what I learned how to set up randomized controlled trial, how to set up some simple projects is different. I definitely learn much more now than, when I was just FY1 or 2, in my clinical job, somewhere, in a district small hospital, and I couldn't do that. I do have access to, opportunities to for example, in Barts, as I said, I did my PG, and now I have opportunity to organize randomized control trial or be part of other research trials. So as a consultant, you know how to set up, because during that time, you can use the tools they provide you with. Okay, they will support you when you apply for, let's say, next job, next academic opportunity. And then why are you doing that particular, let's say, ACF, ACL? You have time to do your research and time to basically learn, what you need to, do in the future. So when you finish your job, academic job, you have wider and bigger understanding of how to conduct the research. You gain your network, and you definitely can be more successful in applying for particular future grants that, that you, for example, grants for your research that you would like to, do research into. So that would probably, the biggest opportunities. But, being just regular clinical, you can still do it. It just probably will take a little bit more time and extra time, to do your private time to do the same stuff, because you will be expected to be 100%, in a hospital, and doing some busy jobs like medicine, let's say, gastroenterology, respiratory, or let's say surgical jobs. It's very challenging. It's very challenging to find extra time to do so. But it's doable, okay? It's doable. Don't think you need to go for academic job. I encourage you to do so.
Yes.
But if you didn't get the job, don't worry. You can still do what you want to. This is one of the options. And there are many options to achieve what you really want to do. And even if you're on an academic path, you still don't have to be academic. That's nice about this, okay? That they will underline to you at the beginning that if you do, we want to provide you with the doors open to PhD. And so you can collect the data, right? So you have this 20% of the time you collect the data during ACF, and after that, you take the time out of, training, and you write up your PhD. You do, so you can do 2 years even. You can do 3 years, right? You can continue, you set up your laboratory, and then you go off for 3 years, do lab work in the first year. The second year, you analyze results, you repeat the samples, and you write up your papers, and you submit your thesis on the third year, you defend, and you come back to clinical, right? So it's supposed to ease your way into completing the, achieving the PhD, for example, or later on as an academic clinical lecturer in order to achieve your senior or professorship.
Thank you very much. So it's very flexible, right? That's good.
Well, yeah, it is flexible. It is flexible, and it's very nice scheme. I must say, it's very nice scheme.
Okay. Thank you so much for that, Urszula. It was very insightful. I'm sure some of the students are probably having a few questions. So we're just going to open the floor to you guys now. If you have any questions, either you can unmute yourself and ask the questions or put it in the chat box and she'll be happy to answer. I think we can have another 10 minutes. Is that okay, Urszula?
Yeah, sure.
Okay. So there was a question from earlier by 1412. Could you please repeat where to put the request? That was the question.
Sorry?
There was a question from one of the students that asked, could you please repeat where to put the request? If you could just elaborate on this question, please. The name is 1412. I think it had to do with when you mentioned, oh, the request for
systematic review. But you mean where to put a request to Cochrane review, how to do it, or so systematic review is a Prisma review, okay? Prisma. Cochrane review is a meta-analysis which you register. So every meta-analysis that is published via Cochrane, and that's the most reliable, which you should read, okay? You put a request to Cochrane and you register your particular topic. So let's say you would like to evaluate effectiveness, like what I initially did. It was effectiveness of spinal drainage on preventing ischemia of the spinal cord. So you write to Cochrane review and you register your interest that you would like to do that kind of review. And then Cochrane is so great that they actually take you through, okay? They actually take you through step, what you need to do, what you need to deliver. There is a template they send to you. Prisma is more flexible, is a systematic review, which is a review of current evidence. And it can be retrospective studies, okay? It's a little bit different than Cochrane review, okay? And then it's more flexible. And you Google, Prisma review, and there is a guideline how to do it, and you follow that guideline. So you don't have to put a request, for Prisma. You just follow the guidelines. With Cochrane, you register. You don't put a request. You register them. You send on a Cochrane website, there is a link that you can, query. But first you need to research whether your idea is already being, analyzed and researched.
Thanks, Urszula. Just checking for more questions.
I have a question. Obviously, with your ACF, you said you do about 20% academic work and 80 clinical. In that 20%, is there any expectation of maybe you have anything specific, like targets wise or things that you're expected to achieve?
Yes. So I'm expected to write 3 papers a year, okay? But it's not written. It's actually more. It's required 1 paper, but they will say 1 paper anyone can write. So it's kind of 3 papers that they require you to write.
Okay.
But you don't have to, as I said, you don't have to take that 20% time, research time straight away. You can say, actually, the first year I would do clinical, and the second year I will take 1 month block, during which I will go and do my lab work, and I will reflect on what I did. So it's more a block of 3 years, or foundation is a block of 2 years, over which they expect you to do stuff, right? And it's more like, rather than expect you to do stuff, it's more gain experience in particular topic that you're interested. Go to the, to the unit that you would like to do, visit the laboratory or set up collecting the data, right? So let's say you have to collect the samples from patients or the blood, or work on some biomarkers. So you will have, let's say, 1-2 months, which you can take in blocks, to write on that, or even, as I said, explore other options and go and work next to some professor and help him in his research. At the same time, getting to know his group, his laboratory group, and finding out, do you want to actually work with this professor? So that's what you do. Usually what they, what's happened, you email a particular group, scientific group that you're interested in, and say, well, I read, I really would like to do a research in, in, let's say, COVID or respiratory topics, or, cardiology, let's say, stenting, or, atrial fibrillation control, whichever, GP as well, introducing new guidelines into GP practice. And I found your center very interesting. Would you mind if I will come and work with you for a while, and, and maybe consider future work? So that's what you do, but you can take this time, like, in various times. They do expect, because ACF is more advanced than a foundation program. So they do expect from you to produce papers, okay, or evidence that, you're interested, but it's flexible over 3 years.
Okay. And I think you said that it's kind of, that there's, the ACF is meant to be a stepping stone, or it prepares you for a PhD. Is that just out of the skills you learn, or is it also, can you like prepare for grants and things like that as well?
Yes, so first of all, you can get your preliminary data. So you go to the lab, you can help them and, get, usually the professor has some small grants for that kind of preliminary data. Mm-hmm. So you get your time to write the proposal. So you get your time to do your research review, right, with prof. You get your time to get your preliminary data of few patients or few samples, or, just the abstract. And then based on this result, you can apply for a particular grant for your PhD with your professor. And usually it starts with helping him write, or sometimes you can just enter the grant he has, because he's looking for, interested people. And when you're on academic pathway, you will be, you will have time to help him out, write this grant, and be a future PhD student of his group, of her group.
Okay. No, thank you so much. Yeah. It's really helpful. You're on mute.
Oh, and I would like to, I think I didn't mention, when you guys apply for your foundation, or, because usually you can, a lot of people apply after foundation year, right? For, ACF. At the beginning, usually you kind of want to find out what you really like. Although there's a lot of students which I admire, they know from the beginning what they want to do. But when you apply for those jobs, when you apply for academic job, it's actually it's actually 3-stage interview. So you need to pass your clinical, okay? So you need to get your points in clinical application. You need to be selected, and then you have separate research academic interview, okay? So it's more demanding. It's definitely, when it comes to application, it's wise as much, because you need to write your research, experience, application, and at the same time, you need to prepare for your clinical, and you need to succeed in both in order to get an academic clinical lecture fellowship, okay? So you apply in both, a clinical and research. And then if you're successful in clinical, only then you can be appointed in research. As a research.
Is first, then you get the academic number.
So they will run the interviews simultaneously, but in order to be considered for research, you need to be successful on your clinical interview. And for example, for cardiac surgery, it was a clinical national selection. So you need to so first of all, you need to be shortlisted for clinical. When you're shortlisted for clinical, first you apply, your academic posts go first, sorry. So first you apply for your academic job, then your clinical jobs come out, okay? So you need to be shortlisted for that. And then you go for your clinical interview, and you need to get, you need to hit the bar of the points, let's say 75%. And if you're successful, then you will be considered with other candidates for research job. Okay, so you always need to be successful in your clinical interview, and then they take on top of that your research interview. Okay, so it's combined, it's never isolated.
Mm-hmm. Awesome. Thanks so much for answering my question.
No worries.
We have another question from Roshni. Do you have to apply for the academic foundation program before the start of the foundation years?
Yes, yes, they do. I think they run the same, but please make sure you double check, okay? Because those rules sometimes change. But the same with the core training, you apply before. You apply the academic jobs, obviously. It depends which specialty, okay, guys? So please don't, don't take, for example, in surgery, that's how it works. You apply for, the research jobs come out before, before your clinical job, and then you apply. But it might be different in GP or medicine. You have to double check, but usually you apply before.
So she is an IMG outside the UK on the PLAB pathway, and the FY2 standalone fits academic application.
Often fits our academic application. So yes, so FY1 is a clinical job, right? So FY1.
So this is an IMG outside the UK. She's probably going to do the PLAB and do a standalone F2. So she's wondering if that pathway would work as well for an academic foundation.
You mean ACF? Because obviously she started as a F2, she's already as a F2. So, so it's already, not foundation year 1. So I'm guessing she will be able to apply for ACF. Because she will be already on the 2nd year of her foundation year program, and according to the picture, academic foundation program, AFP, it's F1 and F2, right, level. So you apply for that in the your MBB when you have your MBBS. So when she's a F2, she will be able to apply for ACF. But she will have to apply for clinical too. So there will be 2 applications.
Thank you. Thank you. I hope that answered your question, Roshni. Yeah. Okay, so if that's all, then we're going to wrap up here. The feedback form has been sent. Please fill that up if you want to get your certificate of attendance.
Oh, and can I just ask you, please provide my email? Okay.
Yes. They've asked for your email.
Yes,
so.
Provide my email, and everyone who would like to ask and are shy or have some queries or would like to do PhD or project, do not hesitate to email me, contact me, okay? I will put my money forward, so you don't have to worry, okay? This is your networking, okay? So you can email me, you can ask for, your particular interest. I can try to, for example, ask my ACF, and if it's not in the surgery or cardiothoracic, I can, maybe send you to someone else who can help you out, okay? If I can't help, I will apologize and say I cannot help, but I will try, okay? Yes, and if you're looking for some PhD opportunities or research opportunities or project that you would like to do in surgery, or you need someone to just look at that and maybe, give you a few words of advice, please feel free to email me, okay? I might not answer the first time, like within a few days, but I will try to address, okay, the issues or problems or direct you maybe.
Right. As her junior, I can vouch for every word she says. So please feel free to contact her. She will definitely help you. She is very inspiring and hardworking. And thank you so much, Urszula, for making it today, despite it being so busy for you. And it's been a long and stressful day for you, right? Thank you so much. We've passed our time, but we still have people sticking around. So that says a lot about your session. It was totally worthwhile for me as well as a junior fellow, even though I'm not a medical student. So yeah, that's all the text for you.
I would like to all of you wish all the best. I know how it is, but it's just the beginning and all the doors are open, okay? Never ever allow anyone to tell you you cannot do something, okay? You can do whatever you want and the limit is your own mind, okay? Don't, like, you know, whatever ridiculous thing you want to do or research you want to do, just do it. Answer all the questions, ask them, and never ever be ashamed or, you know, hesitate to, you know, to ask stupid questions. There's no stupid questions, there are only stupid answers. And I wish you all the best with your finals and with your medical career. And I, you know, I really say thank you for, you know, being around and helping us out, and wish you all the best. Okay, guys. And as I said, if there are some questions that you would like to ask me, or you were late for the talk, you know, I maybe, you know, in the future I can prepare more slides rather than have an open talk. So, you know, but I try to address as much as possible, okay? But yeah, please, my bonus to all of you, send me an emails, tell me if you want to do PhD, maybe I can help you out, maybe you can help me out with my research, and contact me, okay? So,
Ursula, do you mind putting your email in the chat? I don't remember.
Yes, of course. I will put my professional email, my NHS, I mean.
While she's doing that, this is just for all of your information. Our previous session has been recorded. This session's recorded as well, and they will be uploaded on the NMRA YouTube channel. So you can always refer to it and also ask your friends who couldn't attend to maybe take a look at it. It might be helpful to them too, I'm sure. And thank you all for sticking around.